Hello, everyone. My name is Isabella, and I'm currently a junior at the University of Pittsburgh School of Nursing. And today I'll be presenting on utilizing the 2018 Pennsylvania or PA LGBT Health Needs Assessment to assess the interest and engagement in healthy lifestyles within the Allegheny County LGBT community. And this presentation is in collaboration with Dr. Brenda Lee Cassidy, Dr. Andrea Fischel, and Dr. Betty Braxter, all associated with the University of Pittsburgh School of Nursing. So starting off, we would like to acknowledge the acquisition of data from the Pennsylvania LGBT Health Needs Assessment Survey, and with the insistence of Jennifer Dixon Keith, who is the Deputy Director of the Public Health Management Corporation. In terms of learning objectives, we wanted to discuss the level of interest in healthy living strategies, specifically focusing on screenings within the LGBT residents in Allegheny County, as well as describing the healthy living activities that are practiced within the LGBT community members. So this would involve things like tobacco use, alcohol use, exercise, and just general engagement in healthy screenings. So for the purpose of the assessment of the PA health needs assessment, it focused and we wanted to learn about the health and overall wellness of the Pennsylvania LGBT individuals that reside in these communities. For some background information, LGBT communities generally, or community members generally face barriers that affect their health status, in which they report negative experiences. And this is largely associated with the fact that providers may not have enough training or knowledge on how to adequately provide care for members within the LGBT community, as well as not knowing how to address certain concerns which stimulates or generates anxiety within members of the LGBT community. And this increases risk for HIV, diabetes, and limited health screenings. And engagement within the population of the LGBT community depends on how interested they are in healthy living, which then factors into their general health status. So for methods, we did a secondary analysis of the health needs assessment, which was created in collaboration of the Pennsylvania Department of Health and the Bradbury Sullivan LGBT Community Center. And the sample size of 4,679 individuals, and it was a descriptive purpose convenience snowball sampling. And this health needs assessment surveyed various topics such as exercise, mental health, and tobacco use, but we focused on healthy living strategies, reactions to coming out as LGBT, and mental health needs. For sample demographics, the residents across PA, as you can tell, are generally identified as gay, and this was in the categorized as sexual orientation, but there are other categories such as lesbian, bisexual, straight, and another. And a majority of the respondents did reside in the 25 to 49-year-old category. And moving on, insurance is a big factor in terms of providing access or increasing the potential to access for healthy living strategies such as screening. And as you can tell, a large amount of people had insurance, which was 92%. Moving on, the categories for self-identification did include transgender, female and male, but a large proportion of individuals did identify as either male or female, and they identified as white. And within the sample population, 802 respondents resided in Allegheny County. So for results, when comparing both Pennsylvania and Allegheny County, a large proportion, about 60 to 70%, did express moderate to extreme interest in healthy living, which is a very good thing. And specifically in sigmoidoscopy and colonoscopy, more than half of the sample size across PA were screened. And for diabetes, also more than half were screened. And interestingly, the anal pap test for individuals that were assigned male, a majority of sampling in the individuals, they reported not being screened, and this could be because of the negative stigma that is associated with not enough training from providers to adequately address the concerns that the LGBT individuals face. And furthermore, for risk factors for HIV, when comparing Allegheny County and Pennsylvania, there was almost 5 times more people that were screened. And for overweight and obese, when comparing Pennsylvania and Allegheny, there was about the same amount of people. So in conclusion, most participants expressed moderate to extreme interest. It was about 60 to 70% that were interested in healthy living strategies. And going back to the diabetes and sigmoidoscopy or colonoscopy test, a large and more than half of the respondents identified or responded that they did get screened, and in comparison to the anal pap test where a large proportion were never screened. So for members within the LGBT community of both Pennsylvania and Allegheny County, a lot or a majority of the members did respond in having interest in maintaining these healthy lifestyles. And going back to the anal pap test specifically, we want to conduct further research or have the need for further research separating the categories into lesbian, gay, bisexual, and transgender members, focusing on specific screenings and analyzing how certain stigmas may affect their interest, and as well as focusing on the Pennsylvania and Allegheny populations. For references, it would be the PA needs assessment, and that is all. Thank you.
Thank you very much, Isabella, for your great presentation. The presentation is now open for questions. If you have questions, you can go ahead, unmute your microphone, and direct those to Isabella.
Ella, this is Jennifer. Just a question. Do you think that, or is there anything that you found in your research or in your studies that would indicate a potential reason why the LGBT community was at an increased risk for diabetes? Because in my mind, it kind of makes sense, the STD and the HIV aspects, because based on sexual orientation, you're may not having sexual relations with somebody where you could reproduce, so they're not thinking about protective barriers that prevent STDs. But do you think it might be a stress-related reason that makes them more prone to diabetes, or what have you found in your research?
I would say stress is definitely one of the factors, but also the lack of education that they are provided, because of the negative stigma that revolves around them in terms of being, I guess, like anxious to go to providers. They lack that connection and trust. And so they don't have enough information on like how certain diets may affect something like diabetes.
Okay. Isabella, I was curious about the type of screening that you chose to look at or investigate from the data set that you presented. So the majority of individuals who identify as LGBT in your data sets were between the ages of 25 to 49. That's what one of your slides suggested.
Mhm.
Is there a particular reason why screening for colonoscopy and doing a sigmoidoscopy was selected? Because these are, screening tests that are not usually done in that age group. These are screening tests that is usually done in older age groups, or if people have some indication that there is a need to do a colonoscopy. So these are not routine. So why were these included, and any insights?
In terms of the like how I focused on those specific tests, we wanted to highlight the not so common tests because when we looked at the data set, the common tests were a general population and a large majority of respondents were screened. So I thought it was an important component to include and highlight how like these there's an increasing need for these uncommon tests to be used in this certain population because of the, I guess, like going back to what Jennifer said, the indirect and disproportional effect of how a lack of education may associate with like higher rates of STDs or HIV.
Okay, thank you. Other questions for Isabella?
That you thought was the most surprising thing overall? Like, what surprised you?
Um, I guess this was, I think, not going back to like the sample demographics. I wasn't very, I guess my knowledge wasn't as like equipped with how certain terms are associated. Like, for example, we did have a discrepancy between what transgender entails in terms of what like whether it's a self-identification or sexual orientation. So I thought it was interesting how transgender is categorized as self-identification along with female and male, because I always thought it was more categorized as like in like sexual orientation with gay, lesbian, and bisexual, if that makes sense.
We have a question from Julius. And Julius is asking, how easy is it to screen LGBT population? So I guess in terms of any kind of health screening test that you do, how easy is it to screen this population?
I think it largely depends on how welcoming the clinics or providers are. As we've learned in previous nursing classes, it's important to provide a, I guess, clinic that is all inclusive. So I think the more inclusive the providers are and or the title of the company overall, it's easier to screen versus um, some companies that maybe, I guess, like if you put up, for example, if you put up like a flag or have like ask for pronouns before providing care, it would be a lot easier.
Mm. Let me take this privilege to ask you one more question here. Why do you think we have disparities in screening and service provision to people with who identify as LGBT? I mean, you'd imagine that all people should access equal care, regardless of sexual orientation, regardless of how we identify by race, ethnicity, or sexual orientation. So, why do you think we have this kind of disparity?
I think it's largely based on the minority that they're definitely considered a minority population, and there is a stigma that is associated with the population, and so that disproportionately affects our bias as well as their bias in terms of looking for a provider that is inclusive, and I guess also us like towards in terms of our bias, I think we generally don't get enough training, or we don't take the time to educate ourselves on how to address their concerns and be all inclusive.